One of the things I think we also discovered is that not everything fits every community. And that's actually the health equity piece of the new national approach to our role in health. Health equity is tailored towards the uniquenesses of that community. So we look at jobs and education and housing. We look at capacity to thrive. We look at environment. We look at health care. And that's community to community. So a cookie-cutter approach is not going to work. But those stories that happen out in Gove County compared to Crawford County, compared to here in Riley County, and sharing those stories give people an idea that they can actually take to their own community and try it out.
We all make choices every day that impact our health. However, linking our health solely to the choices we make doesn't tell the whole story. There may be other factors that influence our health and individual behaviors. In 2020, the Extension Committee on Organization and Policy appointed a Health Innovation Task Force to revisit the 2014 Cooperative Extension Framework for Health and Wellness and make needed revisions. Last year, the committee released Cooperative Extension's National Framework for Health Equity and Well-Being. On today's Sound Living, Extension's role in community health. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Associate Professor and Extension Specialist in Youth Development in the Department of Applied Human Sciences and Kansas Health Foundation Distinguished Professor of Health at Kansas State University, Elaine Johannes, says the revised plan focuses on three core themes: health equity, social determinants of health, and working through coalitions to increase community health assets. Elaine, in your role at Kansas State University along the health lines, a lot of things to talk about when we're looking at health, and this is something that Extension has been doing. In fact, they really went through and revised some of their old findings.
Mm-hmm. Yes, Jeff. First off, thank you for asking that. You know, when we say the word health, golly, a lot of people are just tired, right? Because the pandemic and all of the ripple effects from that. But we seem to be looking above that maybe and looking a little bit better. I think overall Kansans are aware now that our health is part of our community and who we are. So for Extension, what's really interesting is that nationally, Extension started to think about Extension's role in overall health and well-being well before the pandemic. And since that time, back in 19 is when the United States Extension System started to look at our role in health. We have a revised framework, and it's an avenue to motivate and recognize Extension's collaboration on overall health and well-being. So the framework was introduced back in 2021 at the end of that calendar year, and it provides for Extension systems some recommendations and some insights into our role alongside all the other providers of health care, medical care, nurturers of community, partners in the environment, and also families and people who live in communities, who live in places where people want to know about how to be well. So the new framework for health equity and well-being lists some really good, solid next steps for Extension. And part of my role and the role of many of us here within the university and across the state with the Extension system is to further our efforts in health equity and being well.
And we're going to explore that over the next several months, in fact, looking at all of those various recommendations. Mm-hmm. One of the things that I always come back to is we often think of health and health care as being the same. They are not.
Right. Again, lesson learned. The pandemic taught us there's a lot of actors, a lot of different systems, a lot of really excellent people who are looking out for all of our health, our general health. Yes, there are healthcare agencies, providers, doctors, hospitals, clinics, those who actually give us care when we want it and need it. That might even include our insurance. So that's maybe comprising 20% of our overall health. And Jeff, I throw that percentage out because that kind of comes from some research that says Americans utilize health care maybe 20% of the time. But there's a lot more that comprises our overall health and well-being, such as the community. Does the community have safe streets to go walking? Does it have water that we can drink? Do we have access to grocery stores? Do we have good jobs? Those indicators, those things really comprise at least half of our overall health and well-being. That includes our mental health. That includes our coping.
I was thinking as you were talking about some of those socioeconomic factors, some of those we can control, but most of those we have very limited control over, and that's impacting 50% of our health. So we really do need to expand if we're going to have a healthier community, a healthier state. And I know that that's something that Extension is really focused on, is not only how can we help at the local level, but how can we have this impact that spreads across the state?
Mm-hmm. I am so glad to hear you say spreads across the state. It actually spreads across community. When the pandemic was, again, at its peak, and you and I are optimists, so we're assuming the best right today, we were in emergency role, right? We were crisis. We were looking for solutions. Some of them were offered that people felt real comfortable with. Some of them were offered that people, maintained discomfort. But it was a short-term response, and I think, Jeff, with the new framework, with Extension's motivation and engagement with community, our history of engagement with community, we take the long perspective of, okay, what is the community? How is the community comprised? Is it a location? Is it a geography? Is it a community of common vision, common affiliation? All of those are called different communities. And for us to really look at overall health and well-being now, we have to take the long spread, the long view. Keep in mind, crisis happens. Emergency measures keep us going. It can, but boy, we can exhaust. And boy, that can take a lot of energy and take a lot of goodwill and trust to continue. So I think there's this mixture of crisis mode, emergency mode, get it done, take care. But now we're in for the long view. And it's a good view as long as we maintain communication and community.
One of my other concerns is, as we move forward, how do we deal with people who are still suffering, people who maybe still have some mental health issues, some people who are still not possibly fully recovered? And I think that some people are viewing this as a little bit of a traumatic experience, and that means that there has to be follow-up. Just because we've taken the masks off and just because the numbers seem to be going down and it looks like we're kind of on the back end of this pandemic doesn't mean that everything is over and we're just back to square one where it was in 2019 or early 2020. We're still going to deal with this, I think, probably for several years.
Yes, you are right. Actually, you're speaking to a personal concern I have today. I have a 32-year-old son who has lost total hearing in his right ear. Emergency measures were taken, but it's been a month now, and that hearing may not ever return. So the doctors are saying COVID may have just attacked that inner ear. That's a long-haul issue. He's well. We're going to persist and persevere. But then we're reading some studies about brain function, and then we know that there's organ issues. And so for the long term, again, yes, the vaccinations work. Masks, we can choose to wear them or not, but it's the long view, and the long view takes community. Because we don't know the real ramifications of having these diseases, these variants. So it's going to take community. And I think that's a real appropriate role for Extension, along with public health, along with health care, our hospitals, clinics, but then also our schools who are educating the next generation of young people to think about, yes, professions and health care. We don't want to diminish that, but jobs and careers for community care. And I think that's a lesson learned the pandemic has really taught us, if we take it on, that we don't live alone. We don't live in isolation. We do rely on our health care, but a lot more of the opportunities and long-term well-being come from community care. And so Extension is part of that. And I'm excited to share some of the stories, not only from our Extension system, but our collaborators who are looking at the long-term working in community for community change. One of the things I think we also discovered is that not everything fits every community. And that's actually the health equity piece of the new national approach to our role in health. Health equity is tailored towards the uniquenesses of that community. So we look at jobs and education and housing. We look at capacity to thrive. We look at environment. We look at health care. And that's community to community. So a cookie-cutter approach is not going to work. But those stories that happen out in Gove County compared to Crawford County, compared to here in Riley County, and sharing those stories give people an idea that they can actually take to their own community and try it out. And together, it's like a little patchwork of good things that are knitted together that comprise a blanket we can all cuddle in. I'm thinking about how warm this could be together. You know, if we could weave these together, these stories and opportunities together, around a framework that I think is going to sustain and build Extension role for long term.
Yeah, I mentioned the fact that there are recommendations included with this. What I didn't mention was the fact that there are a number of subsets to those recommendations. Mm-hmm. And that's where communities would have the option to, this one might work for us. This might be more effective. So it is truly a framework that can be customized.
Yes. That customization is really one of the roles that I have, that our colleagues in community health have, that our people in the field have, is to look at, okay, what are the capacities out in the community? What are the gaps out in community? Can we all help fill the gaps in order for well-being to occur? You know, I'm sounding like we're the only kid in town. No, our public health departments are still out there slogging through this phase of the pandemic and also alongside us for health equity. I do get a chance to present to the governor's public health conference the end of March about Extension being a good collaborator, a partner with public health, a partner with health care, a partner with funders, economic development. So it's looking at what works in other communities, how are we decreasing those health risks, but more importantly, leaning on how can we encourage and support well-being, which is a sense of having, I can thrive today, I feel good today, but also I have a purpose. I have a purpose for being in this town, and I know that I have friends and family alongside me. It's not alone, it's together.
Well, this framework for health equity and well-being is something that we're going to focus on for the next several months, at least once a month, and really get into some of the nitty-gritty of it and some of the areas where we think that Extension can thrive.
Yes, and I'm so glad you said that every month you and I will be able to bring forth stories from the field, stories from community, stories of people that are actually addressing some real important health diseases, but more importantly, fostering health and well-being in the community. And those stories, those examples can be a beautiful inspiration for other communities and other opportunities. And so we'll be able to bring people from Extension in telling the stories, but there's collaborators who are also working through. And again, not all one size fits all, but we do know that there are some examples that we can all learn from.
That's Associate Professor and Extension Specialist in Youth Development in the Department of Applied Human Sciences and Kansas Health Foundation Distinguished Professor of Health at Kansas State University, Elaine Johannes. To learn more about the programs offered by Extension to improve health and well-being, contact your county or district Extension office. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.